Okay, so I've decided that I'm going to start a series for EMTs and paramedics that teaches the basics of pharmacology, and I'm also going to be teaching them what the drugs are for, like a slew of disease states. So that way when you go into someone's house and if they're unconscious or they have nobody around or whatever, you find the medications, you kind of have an idea of what their past medical history is. So the first disease state that I want to talk about is actually heart failure, because it's really prevalent. So you go anywhere and everyone has heart failure. But basically there's four main pillars of medications or medication classes that you'll see. First one being RAS inhibitors, so basically working on the RAS system, ACE, ARBs, ARNIs, and ARNIs essentially is just one medication for now. And I'll go later in detail with that one. You have your beta blockers, there's only 3 of them. Then we go into our mineralocorticoid receptor antagonists, there's only a couple of them. Last but not least, there's also going to be the SGLT2s, and I'll talk about that as well. Looking at our ACE, ARBs, and ARNIs, or your RAS inhibitors basically, you have your angiotensin converting enzyme inhibitors, or ACE inhibitors. They have a PRIL ending. If you have an ARB, or angiotensin receptor blocker, that's going to be an ARTAN kind of ending. And then if you have an ARNI, it's going to be a combination of 2 drugs, but basically it's Entresto is the brand name, and it might say sacubitril valsartan or something like that. Go on to the beta blockers, there's only 3. There's bisoprolol, carvedilol, and metoprolol succinate. Moving on to our MRAs, or mineralocorticoid receptor antagonists, there's only 2 of them, so you might see as eplerenone or spironolactone. Lastly, you have your SGLT2s, your SGLT2 inhibitors, which you have the flozins at the end of the name. So looking at those 4 classes of medication, you might have one from each of those classes, and seeing that on a patient's med list or bottles on the countertop or whatever, it's going to help you determine that patient most likely has heart failure. In a nutshell, if you see those medications, just be careful with the amount of fluids you give and follow your local protocols.